Hi everyone, it's Linda Esposito from Be Clear with Bronchiectasis, and our topic for today is breathing, and this video is going to be about diaphragmatic breathing as part of what I like to call the three-part breath. And as I mentioned in another video, I did a yoga certification 20-something years ago, and I think that's when I learned the three-part breath. Not really sure, but it's very helpful because it really brings the breath through your body. Many of us who have breathing issues, if we're short of breath, we can find our breathing to be very shallow, kind of happening way up here. And we're feeling like we're just like starved for air and not getting enough breath. And so what this technique does is it helps to fully utilize your whole body in breathing. And it's not something that you're necessarily going to be doing all day long, but it is something where you can check in and just take a few three-part breaths and just bring in that nourishing oxygen. So I know that you can't see my belly, so I am going to stand up. No, women do not like to show their bellies, and especially a side view, but I am going to for educational purposes. Of course, I'm just joking around, but it is true. We're often holding our bellies in, and so that is going to impede breathing. If you're interested in diaphragmatic breathing, I'm sure if you Google it, there's just lots of different videos on it, but I'm going to go through it now. So if I'm standing sideways, this is how I normally would look. And if I'm thinking about breathing diaphragmatically, I'm going to puff that belly out, see, just like that. So inhaling and puffing the belly out, and then exhaling and letting it go. Inhaling and then exhaling. One more time, inhaling and then exhaling. So that is the diaphragmatic part of the three-part breath. And in my book, The Be Clear Method, I do talk about diaphragmatic breathing. And sometimes people find it a little difficult to access when they're standing up. So lie down, put a book on your belly, and then you'll have something there, a visual, so that you can see as you inhale, your belly rises, and as you exhale, it goes down. That's one part of the three-part breath. Because the other part that I feel is really important for those of us who have lung disease is trying to expand our ribs sideways. So that would be the step two. The first step is the belly, and the second step is the ribs. And just trying to open up that rib cage. And it might not be that easy for some people to do it because perhaps you don't have the flexibility in your rib cage. Those muscles are deconditioned. And when we talk about breathing and exercise and on and on, all of these things are interconnected. And we have to be patient with ourselves. So we might be practicing breathing, and we also might be doing some expanding of the rib cage flexibility exercises and strengthening exercises to help our breathing. So we have to be patient. I say this to myself too, because I'm not a patient person, but I always strive to be, and just see if over time we can make a difference. So again, it's about when we're breathing, seeing that rib cage open up to the side. That's step two of the three-part breath. And I think you could see that by putting your hands there, again, you're going to have that visual that's very helpful. And then the third part of the breath, it is bringing it up high. I mean, if we have already accessed the diaphragmatic breathing, our belly, and we've accessed our ribs and opened them up, then it's okay to bring the breath up as high as we want, and then exhaling and letting it go. So just practicing that three-part breath is another technique to help people who are short of breath and just want, and also those that know that they tend to be shallow breathers and just want to improve their overall well-being and bringing in nourishing energy, of course. Thank you very much. I hope this was helpful. Be well.